during his presentation.
This Chairman for this introduction. So we are running out of time in this symposium a bit, and therefore I will hurry up. You have heard a lot about inflammation and inflammatory pathways in depression, and I will go to the topic of schizophrenia. These are my disclosures, and I'm coming from the Munich hospital where Emil Kraepelin, you know, the founder of the modern psychiatry and the modern classification, was working for many, many years. And I will show that inflammation and infection and psychosis is not a new topic, because already Kraepelin in more than 120 years ago described the relationship between infection and psychosis. And there are several arguments that an infection may play a role in at least a subgroup of psychotic patients. For example, we all know that there's an increased risk for schizophrenia in pregnant mothers, especially in the second trimenon, but not only during pregnancy, also later in childhood, because we know that childhood CNS infection is associated with a 5-fold risk for schizophrenia. For example, it has shown during meningitis epidemic and others. And one interesting point is the description of increased levels of the pro-inflammatory cytokine interleukin 8 in mothers in the second trimenon. These increased levels predicted an increased risk for schizophrenia later in the offspring. And we also looked for some infectious agents. This is just one example. There are a lot of studies about the relationship of infectious agents and schizophrenia, and what we found were slightly increased titers of different pathogens, no significance, but when we put together those titers to a what we call susceptibility index, so then we found a tendency to more positive titers against different infectious agents. So that's one argument that not a specific infectious agent plays a role, but the fact that there is an infection. And from animal models, we also know that if there's an immune activation during the pregnancy of the mother, for example, with poly-IC, which mimics a viral infection, but the same result with lipopolysaccharides, which mimic a bacterial infection, that this kind of immune activation is associated with an increased risk for the offspring to become schizophrenics. And therefore, I think there are a lot of arguments that infectious pathogens, what we call microbiomics, is one of the challenges of the 21st century, because, for example, in schizophrenia, the pathogens seem to play not a role in classical infectious diseases, but also in the pathology and in the resilience of different types of disorders, including psychiatric disorders. And to understand these interactions is very important. But what has all this to do with schizophrenia? Because we know that the dopaminergic neurotransmission is one of the key issues in schizophrenia, but there's a strong relationship between these cytokines and, for example, dopamine. And this is just one example that an administration of the pro-inflammatory cytokine interleukin-8 at birth affects dopaminergic neurons in the adult mice. So there's always the question, if you have a very early infection, why the disease appears only in adulthood, and there might be a connection of this. Interestingly, there are also a lot of findings that show strong evidence for immunogenetic risk factors, especially because we know that there's one risk locus in schizophrenia on the chromosome 6p, 22.1, and on this locus, the HLA system, which is responsible for antigen presentation, for example, but also for others, is located. So immunogenetic seems to play a role in schizophrenia. And I mentioned before the interleukin-8, and interestingly, there's one finding that shows a significant relationship between maternal interleukin-8 levels in the pregnancy and a decreased brain volume in the offspring of schizophrenics. So this might be a link or an example for a link between a pro-inflammatory state and the brain volume, which we know that these are the typical changes which we find in schizophrenic patients. I have shown that inflammation is a risk factor for schizophrenia, and there's one important big Danish study with more than 3.6 million people which were registered, and these researchers looked to the relationship between infection and schizophrenia. And what came out is very interesting. They found, let me say, a dose-dependent relationship between infection and the later risk for schizophrenia. So if there was a hospital contact due to one infection, there was a significant higher risk later becoming schizophrenic. And if autoimmune disorders were also taken into account, this increased even the risk for later becoming schizophrenia. But if you have had 2 or even 3 hospital contacts for infection, so the risk increased even more, and that's what I mean. There seems to be a dose-dependent relationship between infection and the later risk becoming schizophrenic. Due to time, I don't want to go into further details here regarding the microglia activation. That's an interesting model, but you all know that schizophrenia and other psychiatric disorders, of course, are genetic disorders and have to do with the serotonergic and glutamatergic, dopaminergic neurotransmission, but there is still a gap between what we know about the dopaminergic neurotransmission and the risk for schizophrenia, the pathology for schizophrenia. But if we include the immune system, the immunogenetics, but also the immune function, I think we can bridge this gap, because we know, as you have seen, there's a relationship between immune function and the tryptophan-kynurenine metabolism, but also with the serotonergic, noradrenergic neurotransmission. So that means inflammation may be an important pathological process which takes place and which can bridge the gap between the neurotransmission, what we know about the neurotransmission, and the pathology of the disorder. Now let me shortly come to our clinical studies. We know you have already heard from Brian Leonard about the cyclooxygenase 2, which is expressed in inflammatory states, especially in the periphery, but in the brain there is an expression of the COX-2 without any inflammation, it's a so-called constitutive expression. So it seems that there's a special role of the COX-2 here in the hippocampus, but also in the amygdala in the brain. And this was the first study we performed with the celecoxib in schizophrenia. So all patients got an antipsychotic, and half of them additionally the anti-inflammatory agent, and the other half placebo. And what came out was what you can see here. This is already an older study published in 2002. Those patients who additionally got the celecoxib here in blue, they have this overall significant better outcome compared to those who only got the risperidone and the placebo. But it seems that this might have to do something with the duration of the disease, because another study in very chronically schizophrenic patients, a mean duration of the disease 20 years and 27 years in the placebo group, there was no effect of this anti-inflammatory medication. But in a study from Iran, from Tehran group, there was also a better outcome in chronic schizophrenic patients, which you can see here, risperidone and celecoxib, better than risperidone and placebo regarding the general psychopathology and also the total PANSS total score, that means the total schizophrenic symptomatology. So it seems to be dependent from the state or the stage of the disorder, if there is an effect, a positive effect of the celecoxib, and therefore we performed a study in first manifestation schizophrenia. Again, the very similar design, but in this kind we used the amisulpride as a basic antipsychotic and not the risperidone. And what came out here was, again, here in the PANSS global score, a better outcome of the amisulpride and celecoxib group compared to the placebo group, and the same here in the PANSS total score. And even regarding the negative symptomatology, we saw a significant better outcome compared to placebo. So in the meantime, there are several clinical studies of this selective COX-2 inhibitors. You have seen most of them, but interestingly, there's also one study with the mixed COX-1, COX-2 inhibitor aspirin as add-on therapy, and also here in adolescents with schizophrenia spectrum disorders, and here you can see a positive effect. In the meantime, there have also been published meta-analysis of the non-steroidal anti-inflammatory drugs in schizophrenia, and also this meta-analysis from 2012, it was shown a benefit from the anti-inflammatory treatment in schizophrenia, and there's a second meta-analysis with a bigger sample, which also shows, especially in those patients with a short duration of the disease and or first manifestation patients, that the anti-inflammatory therapy as an adjunct use additionally to antipsychotics have a benefit compared to the placebo. There are some other new therapeutic strategies in schizophrenia with immunomodulation. I cannot go into details here. Interestingly, there's the minocycline is an interesting substance, the second generation tetracycline. The omega-3 fatty acids have also been shown some data here, and these are possibly also promising strategies. So let me shortly summarize. We have a lot of evidence for a slight, possibly localized inflammatory process in schizophrenia. The COX-2 inhibitors, they rebalance the immune response by inhibition of the prostaglandin E2 and the pro-inflammatory cytokines. The celecoxib has beneficial therapeutic effects in schizophrenia, in particular in patients with a short duration of the disease. And glutamate modulators also are related to the immune response. Also, in the moment, we don't have specific immune modulating therapies today. So altogether, an anti-inflammatory therapy seems to be effective in major psychiatric disorders. Thank you very much, and thanks also to all my collaborators.